Hi friends, today I'm here with another case note explanation. This is a letter to an occupational therapist. So let's read the case note first. So first of all, I would like to thank each and everyone for supporting my channel. And if you're watching first time, please like, subscribe and share with your friends so they can also benefit. Thank you. So let's read together. Today's date 5/5/2017. Patient details: name Joe Black. Date of birth 1/5/1990. You are the nurse in charge of the rehabilitation ward at Pindara Private Hospital. Joe Black has been transferred to your ward from the Gold Coast University Hospital. Medical history: fracture left wrist, 7 years old, anaphylactic allergy to penicillin and endol. Social history: lives with parents and younger sister, 15 years old, full-time tertiary student, third year Bachelor of Law at Queensland University of Technology. Family live in two-story house on a fairly steep hill and there are 5 steps at front entrance. Then motorbike used to be his daily transport to university and other social activities. Hobbies: riding his horse and surfing weekly, dirt bike riding occasionally. Current admission on 10/3/2017, BIBA. What do you mean by BIBA? Brought in by ambulance. In emergency department, Gold Coast University Hospital. You can find some acronym videos in this my channel, so just try to go through that. Following a motorbike accident on the highway on his way back home from university, X-ray and CT scans completed, multiple fractures to upper and lower limbs, fracture left hip, fracture ribs, fracture right arm placed in fiberglass cast, injury to spinal cord, fracture T1 to T8, emergency surgical treatment, total hip replacement for his hip and surgical spinal intervention in order to stabilize the injury. Diagnosed with permanent paraplegia due to nerve damage in thoracic vertebrae. So on 11/3/2017, transferred to orthopedic surgical ward for further investigation, post-operative treatment and recovery, permanent suprapubic catheter inserted due to loss of bladder muscle, control due to spinal injury. Then on 15/4/2017, transferred to Pindara Private Hospital for further rehabilitation therapy, physiotherapy, rehabilitation for regaining muscle strength, learning to cope with his new restricted mobility condition and avoiding lower limb muscle dystrophy. On 1/5/2017, start mobilizing wheelchair, regain full strength and utility of arms and upper body muscles. Patient worried to return home due to the house setting. Discuss the help of occupational therapist, further rehabilitation and assessment. Discharge date planned is 15/5/2017. What are the discharge plan? OT referral for patient's disability assessment and further rehabilitation to help him regain as much independence as possible with the activities of daily living, ensure he has necessary aids to provide support with mobility and ADLs, house assessment, modifications to be suitable for wheelchairs such as ramp over stairs, double doors, modifications made to the bathroom, toilet, disability rails, commode, showering chair, daily home visits for the first 2 weeks, teach and support him to adapt to the new modification made. Regular physiotherapy sessions to avoid muscle dystrophy in lower limbs, regular GP's appointments to check the suprapubic catheter. It's not superpubic, should be suprapubic catheter. Then writing task. You are the nurse in charge of the rehabilitation ward at Pindara Private Hospital. Using the information provided, write a referral letter to Anne-Marie Johnson, the occupational therapist in charge for the rehabilitation patients in Pindara Private Hospital, 1182 Bermuda Street, Southport, Queensland 4220 requesting assessment of Joe's disability level as well as necessary aid, support and therapy in order to help him to adapt and regain independency to live a life as close as possible to normal. So this is the request. So the reader is occupational therapist. So we should include the relevant information which is necessary for an occupational therapist. So here I am going to give an example. You can practice in your own strategy. Just follow it, but I am just giving an example. So the first, Miss Anne Mary Johnson, occupational therapist, Pindara Private Hospital, Southport. The date is 5 May 2017. Dear Miss Johnson, reference Mr. Joe Black, date of birth 1st May 1990. Then how we can write the intro? I am writing to refer Mr. Joe Black, who has permanent paraplegia following an accident. He requires disability assessment and further rehabilitative support to regain independency. He is planned to be discharged on 15 May 2017. Then next we can write, either you can write initially Mr. Black was brought to Gold Coast University Hospital on 10 March 2017 due to multiple fracture and spinal cord injury, for which he has undergone the surgery successfully and treated conservatively. Otherwise, how you can write? Mr. Black transferred to our hospital on 15/4/2017 for a rehabilitative therapy following multiple surgeries at Gold Coast University Hospital due to multiple fracture and a spinal cord injury. Like that you can write. Then he has been initiated with the physiotherapy. The next paragraph we can write, currently Mr. Black can mobilize, or you can write Mr. Black can ambulate with the help of a wheelchair. He has regained full strength and utility of arms and upper body muscles. However, he is worried to return home owing to the house setting. Next, we can provide the social history. Mr. Black is a tertiary student of Bachelor of Law. He lives with his family in a two-story house on a very steep hill, and there are 5 steps in front of the entrance. Then let's move on to the recommendation paragraph. It would be appreciated if you could visit Mr. Black at home and perform necessary assessment. Please ensure he has necessary aids to provide support with mobility and self-care activities in order to help him to adapt independency as possible to normal. Or you can do self-care activities in order to help him to regain his or make him self-reliant. Like that we can write, please provide modifications to be suitable for wheelchairs such as ramp over stairs and double doors. In addition, some adaptation or adjustment. Instead of modification, you can write like that, transformation of bathroom, then toilet, disability rails and commode showering chair would be beneficial for Mr. Black. Kindly continue home visits for first 14 days to teach and support him to adapt to the new environment or new modifications or alterations, adjustments. Like that you can use the synonyms. Plus you can write the concluding sentence. So please do not hesitate to contact me if you require further information regarding Mr. Black, or you can write, please do not hesitate to contact me if you have any queries regarding Mr. Black. Then you can write, yours sincerely, charge nurse. So I think it's clear for you. If you need more information, just try to comment. So keep watching for more videos and subscribe as well. Thank you for supporting. Thank you very much.